I will go shortly through. First, in the morning, we had some introductory lectures. Anya showed us a lot on the endocannabinoid system and what we learned that when our own body endocannabinoid system is going down, we need a little bit of boost of the phytocannabinoids, bringing them from outside. However, as the second lecture showed, we still don't know which strain or which CannaPaed is the best one and what is the effect of mixing different things. And then we came to the more practical things, and as Professor Kramer and Dr. Grunfeld showed, it seems that we need a lot of reading, a lot of experiences, but it should be started somewhere. So there should be doctors, physicians, maybe also some specifically trained nurses who will start treating patients and specifically learning them what to use and what not to use, what are the possible side effects. However, an overall impression is that all those doctors who are using cannabis seem that it is safe enough that it can be recommended specifically for those patients who do not find any other possible solution in the standard treatments. It seems that also Israel and Canada and maybe some other parts of the world who are using cannabis for a longer time than we in Slovenia, still we need a lot of different recommendations, how to use it, how it can be officially confirmed, and so on. So from the clinical part, it seems that it should be used, but we need doctors and we need medical staff who will be much more educated than today. And the worst thing to do is just to say, no, this is rubbish, cannabis cannot help, and with this we are losing patients, and we are losing the whole families who maybe see that this is the last solution for their health or for their improvement of the quality of life. And in the second part, it seems that regarding the treatment with cannabis, childhood epilepsy is on the top. So the majority of the studies done during the past 2 or 3 years, they are not only showing the effect of cannabis products, but also they were done in a proper way, like randomized and double-blind and so on, and definitely it has been shown that they are effective in certain epileptic syndromes, and this is also what brought us to the first recognition of the drug, which is called Epidiolex, by FDA in the States, and we are just waiting for maybe 1 month from the EMA to be confirmed as well. So this is the first cannabis-based drug which will be able to be used worldwide. And second, which was a little bit less obvious, is whether there is a difference if we treat patients with single molecule of CBD or single molecule of THC, or is it better to have a whole plant extract. For me, because we are not using a lot of the whole plant extract, we don't have a lot of patients, but reading all the articles about this, I think the favor is with the whole plant extract, and as we heard before, the entourage effect is the one which is also should not be neglected, and also the other substances like terpenes and flavonoids inside may have some synergistic effect to help CBD to give better effects, less side effects, and using much lower doses. Professor Kramer, I think he will not agree completely with this, no, because maybe he has much more experiences, because in Israel for a long time they are treating patients with the whole plant extracts, but they were actually never using the one molecule CBD for the comparison. We didn't talk about autism much. Unfortunately, Professor Adi Aram, because of the personal reasons, was not able to come, but maybe this is something for the future. And we didn't talk much about cerebral palsy. There are some studies showing the good effect of cannabis, specifically for the severely disabled children with cerebral palsy who have severe spasticity, which we know that it is increasing during the years with the aging of the patients. So patients of around 15 or 20 years of age, they can have severe spasms and severe sleep disturbances because of this spasticity and because of the pain. So it seems that there are certain strains of cannabis, specifically with higher dosage, with higher ratios of THC, which can be quite helpful. And as we heard a little bit about autistic children, that the best effect is actually regarding the behavior and regarding the aggressiveness, which is of course the worst thing in autism, which also happens with aging of the patient. And finally, there are different techniques to analyze the cannabis products. However, whenever we are dealing with the patients who are taking, I call it artisanal or domestic or home products of the cannabis, it is wise to have analysis made before you talk with the patients, because before you talk with the parents about how it should be used and what are the possible side effects. And once again, it seems that the side effects are transient and that they are mild. Any other comment? If not, I will stop here. I will thank once again all the lecturers, all the speakers, and all the audience for their valuable comments. And I do hope we will repeat such a symposium in a year time, or maybe a little bit more, to have more sun and to have more fun. At the end, I would like to thank all the staff from Ljubljana and from MGC Pharma for their constant help. It was quite a lot of emails and telephone calls and so on. So specifically, I would like to thank Alex Abramovich for her constant help. Thank you, Alex. On the Slovenian side, it was Branka Kenda, the secretary, of the medical faculty who did a lot of domestic things. Thank you, Branka. I don't know if she's there. And finally, you have seen Rok Kuchan, the Dr. Rok Kuchan, who helped us a lot with the technical part and was kind enough to do all the housekeeping things. Thank you. And finally, also the head of the Department of Child, Adolescent and Developmental Neurology, Professor Damian Osredka. Damian, where are you? There. Because the idea to do this symposium was his. It was a very good idea, Damian, thank you.